Dr. Zweli Mkhize, the Minister of Health, who has actually hit the ground running. Now, on his first day, I think, or second day at work, together with the MEC of Health here in Gauteng, they had to run to Mamelodi Hospital, where something that a lot of people defined as almost a sample of what happens in our health, our health facilities happen behind our back, or maybe not so much behind our backs. Now, I thought I would start with that because the video is not for sensitive viewers, so do be warned for that. Let's just take a glimpse at that before we get on with that conversation.
Isn't that another method that you guys can use? It's my mother just met, she's proper 76 years old. And this is what you're doing to her. Our hospital that's supposed to look after her. This is what you do to my mother. Please come and make her loose. I'm scared of it. It is scary, Sonia. Sorry, Mama, sorry.
Painful stuff there. Of course, we talked to the minister and the MEC on that day who promised that action was going to be taken. Minister, welcome and thank you so much for coming all the way here to Linden to visit us.
Yeah, thank you very much. Very sad video that.
Yeah.
It actually came on the day I was sworn.
Yes.
Yeah, very unfortunate.
We'll talk about the NHI just now, but did you get a sense, and you have been in the leadership of the ANC, in the leadership of KZN, in the, in the health profession and so on for a number of years, do you get a sense that our health system is in a crisis? When you see something like that, that could well be happening in other places, and one is not wanting to exaggerate or sensationalize it, but it's something you can't ignore. And maybe, as the universe may sometimes speak, it was speaking to you as that happened on your first day at work. Do you get a sense that our health system is in crisis? And now you're talking to the country with doctors and nurses who work in those systems, listening to you, and I would want to know what your answer is as we kick off this conversation.
Well, in a way, we can say it's in a crisis. Let me just describe to you what type of things have happened. Firstly, you've had a country that over the years has had to open up all the health facilities to all people. And as a result, some of the facilities that were spared of huge traffic are now overrun because people are now able to go all over. So you feel that there's pressure everywhere. Secondly, the numbers of our people has increased. And the size of the facilities have not necessarily increased proportionately to the size of the population increase. Then there's a huge problem of movement of people who are not in the same areas where they used to live. So there are areas where there's a lot more pressure, particularly urban centers, towns, and those hospitals in those areas have got that kind of pressure. In addition, we have had huge rise in the burden of disease. For us, the communicable diseases, the HIV, the tuberculosis, those are on the rise. And their huge impact is on the communities, particularly poor communities. And on the other side, we have also got what we call non-communicable diseases, blood pressures, obesity, cancers. They're all rising at the same time. So the combination, we're calling it twin epidemic, because in the developed countries, they dealt with the communicable diseases, finished them, and then only they started having the problem of non-communicable diseases. Therefore, they had time to focus on the difficult diseases. Now, in our case, we've got to deal with both. We're dealing with both when, in fact, the country's economy is not doing so well, when the numbers of the population is rising, but also when you've got competing priorities, because this is a new democracy with lots of competing priorities. So you can't focus on just the one issue of health. You have to deal with education, human settlement issues, safety issues, etc., etc. So this is a combination of the challenges. That
are you saying that therefore the system can't cope with the numbers of people that it has to serve?
I'm saying that what people are feeling is real. And I'm explaining why it is like that. It is because there's a lot of pressure. And you must understand the numbers of people who work in the health department is very huge. but also you get very dedicated people in there. But with time, with pressure of disease, with staff shortages, with long hours, with long queues, and you've got lots of, of pressure on people, and therefore you find there are lots of things that sometimes are unacceptable kind of behavior. Sometimes people take shortcuts, they're trying to do things because that's all they've got. So sometimes you get all those kinds of things. Of course, you'll have the odd one who will behave in a way that's unacceptable, and then, of course, for those we have to act, we have to deal with them.
It sounds, from what you are saying, it sounds like, in a sense, you are almost halfway there to having universal health care from a point of view of access. And you are even saying that so much access that the system can cope. How is NHI, in your view, going to alleviate these clogs in the system, if you like, a poor service to the recipient of this service? In a short, because there's always the criticism that, oh, no, there's chaos now, and so on, with whatever reasons you may have mentioned, right? And then you're going to introduce another system, it's going to make things worse. Why don't you fix first? I know that sometimes, people will always, who are outside, the responsibility of governing, may always have an excuse of why certain things can't happen. And I'm not there. I'm just saying, briefly, and we'll deal with this straight after, I'm telling you I must take a short break now. Straight after that, I want you to just tell me, in simple terms, how will the NHI alleviate the kind of crisis that we are seeing in the health sector? We're talking to Dr. Zweli Mkhize. He's the Minister of Health, newly appointed, still within his 100 days, right? And he's going to share with us his vision about how to sort out the health system. You take notes there. And then, of course, you can also send us your views as a WhatsApp line where you can send us your questions. But also you can follow us on #YourViewOn405. Let's take a break.